Still on matters health, CI and Busia counties bear the greatest malaria infection burden in the country, with a prevalence of 6 times more than the national target. The latest report released by the Ministry of Health on malaria control also reveals that the coronavirus pandemic provided another challenge to the fight against the malaria disease. Health Cabinet Secretary Mutahi Kagwe, who spoke during the launch of a Malaria Control Council in Nairobi, cited difficulty in securing essential health commodities in a timely manner as the greatest bottleneck to the fight against malaria in the country. Purity Museo has more details.
The Ministry of Health has unveiled a Malaria Control Council, the 5th to be launched in Africa, which is expected to play a critical role in the mobilization of resources to drive the elimination of malaria in the country. Health Cabinet Secretary Mutahi Kagwe challenged the council to fast-track the malaria elimination strategy, whose theme is Zero Malaria Starts With Me.
Africa is not on track to achieve its 2020 target of reducing malaria incidence and mortality by 40% and the goal of eliminating malaria by 2030.
A health ministry report reveals Busia and CI counties are bearing the greatest burden of the disease.
To mitigate against this, we plan to accelerate efforts that will include application of measures to spray and kill mosquito larvae at the source in these counties during the second quarter of this calendar year.
Stakeholders in the health sector are calling for resource allocation, pointing out that the malaria strategy was facing a resources gap of up to 24 billion shillings.
We are ready, willing and able to meet the charge that we have been given. We dedicate ourselves as malaria champions and will work as partners to the National Malaria Count Program and the people of Kenya to end malaria.
According to the World Health Organization, in 2019 there was an estimated 229 million cases of malaria worldwide. The estimated number of malaria deaths stood at 409,000 in 2019. Children aged under 5 years are the most vulnerable group affected by malaria. In 2019, they accounted for 67% of all malaria deaths worldwide. Purity Museo, Channel 1 News.